everyone. We'll be discussing on two important topics of rehabilitation, that is functional and occupational rehabilitation. That will be the main concern topic for today. To start with, we will give a brief introduction about rehabilitation. Involvement in moderate or rigorous physical activities was and will always be an integral part in the life of human beings. Each and every individual has to perform a wide variety of movements in their day-to-day life. Most importantly, involvement in a variety of wide range of movements is a part and parcel of a sportsperson's life as well. Just as movements are inseparable from our life, similarly, a very famous saying goes that injuries are the ornaments of a sportsperson. The whole training process of a sportsperson ranges from general exercises, which is a part of the athlete's warm-up before the training sessions and competitions, and plays an important role in the prevention of injuries as well. Sportspersons at various levels, despite of using all kinds of protective gears of the best quality and minimizing all possible risks of injuries, still encounter minor or major injuries. Many a times, even the slightest bit of carelessness on the part of an individual can lead to injuries ranging from minor to even fatal ones. The immediate step that follows in such cases is first aid and the treatment of the injury. However, the most important function that comes after the whole process of first aid is administered is rehabilitation. In most cases, the rehabilitation of the injured part is ignored, which delays the recovery process or may even lead to permanent damage. Rehabilitation is a process used to give a healing touch to the patients who are suffering from physical and mental disorders, addiction, etc. Rehabilitation programs helps the patient to get back to his or her normal life and earn a livelihood. Rehabilitation plays an important role in the lives of addicts and persons who have suffered from diseases or accidents. Rehabilitation plays a key role in the life of people who have suffered from a trauma. This program is given to patients based on their needs. Every person's requirements vary, so the program is subjective. Personal attention is given to each patient and his or her development is monitored on a regular basis. There are various kinds of rehabilitation programs that are tailor-made according to the needs of the concerned individual. The following is a list of the types of rehabilitation: occupational or vocational rehabilitation, physical, medical or functional rehabilitation, aquatic rehabilitation, cognitive rehabilitation, social rehabilitation, functional rehabilitation is an extension of the traditional elements of physical therapy. Functional training involves more than simply increasing the force producing capability of a muscle or group of muscles. Rather, it requires physical modification to enhance the coordinating working relationship between the nervous and the muscular systems. Functional rehabilitation involves performing controlled movements in an area of dysfunction in such a manner that the improvement in strength, conditioning and coordination, which directly improves the performance of movements so that an individual's activities of daily living are easier to perform. Conditioning is a process of physical modification by which a patient comes to associate a desired behavior with a previously unrelated physical activity. Coordination is the harmonious functioning of muscles or groups of muscles in the execution of the movements. Simply stated, the primary goal of cross-functional rehab specialists is to transfer the improvements by functional rehabilitation to the area of dysfunction by enhancing the performance of the entire neuromuscular system. This highly specialized rehabilitation will help every athlete recover faster and perform better. The purpose of functional rehabilitation is to return the athlete to highly complex movement patterns such as athletics. It follows a certain procedure. Along with the traditional elements of physical therapy such as strength, that is the application of high force against a heavy resistance, and flexibility, the functional rehabilitation program incorporates agility and proprioceptive or kinesthetic training, which enables the athlete to participate at pre-injury levels of activity while reducing the risk of recurrent injury. The functional rehabilitation program is designed to progress the athlete from simple activities such as walking or jogging to highly complex sport-specific activities that require refined levels of proprioceptive acuity. The final phase of the functional rehabilitation program is determined when the athlete is ready to resume participation in their respective sport. This is a very important and sometimes overlooked component of the functional rehabilitation program. The decision for returning an athlete to participation should be made using objective assessments of function that stimulate sports activity whenever possible. Lastly, return to sports activity should be done gradually. Progression into the sports activity is essential to a full and healthy return to participation. Closed kinetic chain and functional rehabilitation have lately received increased attention in the rehabilitation community. An analysis of these biomechanical events in the foot, ankle, and knee under open versus closed chain conditions supports the notion that function results from the integration of muscles and the joints to achieve desired outcomes. This leads to the conclusion that rehabilitation exercises, in order to be functional, must demand integration of muscular activity, must be of a close kinetic chain nature, and must challenge the utilization of normal proprioceptive mechanisms. Functional rehabilitation is one of the most important form of rehabilitation in the field of physical education and sports. As we all are well aware that despite monitoring protection from all aspects, sportspersons involved in sports and games, whether they are individual or team events, have to encounter unforeseen challenges leading to minor or acute injuries. Most of the experts or trainers, in fact, all the trainers and experts render the first aid required for the considered injury. But the part that is neglected the most is to restore the proper functioning to its original state, that is, the rehabilitation of the injured part. Thus, the knowledge of functional rehabilitation is extremely important for a physical education professional or trainer. Next, we will be discussing about occupational or vocational rehabilitation. First, we will put some light on the meaning of occupational and vocational rehabilitation. Many workers have an increased risk for developing common mental disorders, also called CMDs, in the workplace due to job stresses such as job insecurity, bullying, or psychological harassment, low social support at work, employee perceptions of fairness in the workplace, and an imbalance between job demands and rewards. These CMDs may include anxiety disorders, alcohol dependence, addiction-related disorders, suicidal ideation, and depression. Occupational rehabilitation, also known as vocational rehabilitation, is a specialized branch of science that practices the returning of injured workers to a level of work activity that is appropriate to their functional and cognitive capacities, both of which are influenced by the severity of a worker's injuries. The role of the occupational therapist in the workplace is to facilitate individuals' ability to return to work. Occupational therapists assist their clients in reaching their maximum levels of function with the aim of meeting the physical and emotional demands of their job. Occupational therapists are also qualified to make recommendations to employers on how to downgrade job demands to meet the functional status of an employee in order to prevent further injury during occupational rehabilitation. Individuals' functional capacity evaluations are used to screen for person-environment fit. Industrial occupational therapists use a collaborative approach involving the workers and employers to encourage a supportive work environment that empowers the workers to reach productivity and other work-related goals. Occupational rehabilitation's therapeutic interventions in occupational rehabilitation include developing assertiveness, communication and interpersonal skills, controlling anger, and stress management. This particular type of rehabilitation is for those victims who do have lost some important skills after they have met with a paralytic stroke or any unfortunate major accident. We have to perform certain skills like writing, reading, cooking food, etc. every day in our life, without which it is impossible to survive. We lose these skills if our brain is injured. Therefore, victims lose interest in communicating with other people. This particular therapist helps one to do regular physical exercises, meditation to make your muscles strong. The patient is given special care by their counselor and the psychologist so as to restore the capacity of the individual to earn a livelihood. The purpose of occupational rehabilitation or vocational rehabilitation is to help the patient to regain the ability to do normal everyday tasks. It follows certain procedures which are explained. The purpose of occupational or vocational rehabilitation may be achieved by restoring old skills or teaching the patient new skills to adjust to the disabilities through adaptive equipments, orthotics, and modification of the patient's home environment. Occupational therapy is mainly prescribed to rehabilitate a patient after amputation, arthritis, cancer, cardiac disease, head injuries, neurological injuries, orthopedic injuries, pulmonary disease, spinal cord disease, stroke, and other injuries or illnesses. The duration of the occupational therapy program varies depending on the injury or illness being treated and the patient's response to the therapy. Occupational or vocational therapy includes learning how to use new devices to assist in walking, such as artificial limbs, canes, crutches, walkers, getting around without walking, such as using wheelchairs or motorized scooters, or moving from one spot to another, such as in boards, lifts, and bars. The therapist will visit the patient's home and analyze what the patient can and cannot do. Suggestions or modifications to the home, such as rearranging furniture or adding a wheelchair ramp, will be made. Health aids to bathing and grooming could also be recommended. In today's rapidly changing trends in the professional field, it is very essential for a physical education professional to adapt to the changing conditions as it is very essential for the professional to do so, as delay on his part will lead to increasing the workload on the professional. Further, physical injuries also leads to deterioration of the performance of a physical education professional, as involvement in physical activities is a part and parcel of his profession. Inadequacy in work leads to physical as well as psychological issues that lead to vocational or occupational disorders. Next, we'll be concluding the topic by saying that from all the above discussions that have been done on functional as well as occupational rehabilitation, it is crystal clear that rehabilitation is very important for people belonging to different sectors of life. As we know that the main goal of rehabilitation is to restore lost mobility or to return to as normal position as possible. As for a sports person, it is very important to monitor the healing process so that the injured area is not overused and the healing process is not delayed any further. It is a common sight among the athletes that they do not always have the patience to wait for an injury to heal, and it is also common for intensive training to start too early. This emphasizes the important role of the trainer as well as the rehabilitation therapist to oversee the training program to ensure that it is appropriate for the process in both its type as well as the intensity. Along with functional rehabilitation, occupational or vocational rehabilitation is also equally important for a physical education professional, trainer or coach. A professional goes through n number of hindrances in the professional front that leads to physical or psychological disorders that may lead to a destruction of the vocational life of a professional, and hence there should be vocational or occupational rehabilitation of the sports person and physical education professionals as well. Thank you.